Amanda and Steve Rushen had a long history of pregnancy loss.
Well, she had no problem getting pregnant, but her problem was with keeping the pregnancy inside her uterus. And that's a relatively common complaint called cervical insufficiency.
A few months after their 6th miscarriage, they found out they were pregnant again.
We were surprised that we got pregnant with her because we didn't think it would happen as fast as it did.
Amanda and Steve went to see Dr. Alyssa Moore, a peri-natologist at UMC. Dr. Moore did an abdominal cerclage.
A cerclage is a surgical procedure where we put a stitch around the mouth of the uterus to hold it closed so that the pregnancy remains in place.
The procedures helped Amanda get through the first months of her pregnancy. In January, right after the new year, Amanda was admitted to University Medical Center.
The doctor found that even with both of the cerclages being done, that we were having a little bit of issues with me carrying her.
We brought her into the hospital. She stayed in. We ended up, in addition to having the abdominal cerclage, we put in a pessary.
Amanda was put on bed rest. She was hospitalized for a whole month. On her 25th week of her pregnancy, her water broke.
And then all of a sudden, the nurses from the floor came running into the room and said that she was in distress, even though I was not having any contractions or anything like that.
So what ends up happening is they end up doing an emergency C-section on my wife, and I was in there with her as they cut her.
Her being born at this early point in the pregnancy, that she had at least a 25% chance of not making it. And among the survivors, more than half will have some long-term developmental disabilities. You know, this extremely premature baby needed a resuscitation by our NICU team.
At that point, they deliver my daughter, and I hear a little cry. So it kind of gave me hope.
At 25 weeks and 4 days gestation, Alyssa Rushen was born. She weighed 647 grams, a little less than 1.5 pounds. Now it was up to the specialist at the neonatal intensive care unit at El Paso Children's Hospital to help her fight for her life. The first 72 hours were crucial for Alyssa. She was immediately placed inside a giraffe incubator. This critical piece of equipment was purchased through Children's Miracle Network.
We're able to provide an entire appropriate environment, body temperature, high humidity, be able to enclose these infants in a way that we're not intervening with them really frequently, that gives them the quiet, so they can salvage their energy in order to be able to grow and develop appropriately. Alyssa needed to have help with breathing right from the beginning. She needed to have a tube inserted so that her breathing could be assisted by a machine, by a respirator, and she received what's called pulmonary surfactant. This is the lung liquid that premature babies don't yet make that we're able to give.
Alyssa needed to use a life-saving piece of equipment called a high-frequency ventilator to help her breathe while her lungs developed and gained strength. El Paso Children's Hospital is the only hospital in El Paso that has this specific type of ventilator.
Only through the help of the Children's Miracle Network. And this is a piece of equipment that really allows us to fine-tune respiratory care for infants and also to avoid complications from mechanical ventilation in these babies. It's thanks to that that Alyssa has as good of a lung outcome as she has.
Another condition very common in premature babies is bleeding in the brain.
Every time they did a head ultrasound, I prepared myself for the worst. And each time they did a head ultrasound, it came back negative.
And her chances, again, just from her birth weight and how early she was, were at least half that she would have one of these, and she had none. Because of the facility of a children's hospital is due to state-of-the-art imaging, so that all babies in this high-risk category have a brain MRI that's done at the Children's Hospital and interpreted by the only pediatric radiologists in the city who are expert at doing this.
In 2015, El Paso Children's Hospital was one of the first hospitals in the nation that converted to an exclusive human milk diet for all premature babies. This prevented Alyssa from having necrotizing enterocolitis, a devastating disease that affects the intestine of premature infants. El Paso Children's Hospital has breast pumps available for all the mothers who have a baby in the NICU.
Leaving at night was always a little scary because you never knew what was going to happen, but the cameras that they have in the NICU were amazing. So if it was 2 o'clock in the morning and I just needed to see her, or if it was 2 o'clock in the morning and it was due for a pumping session, I could turn my phone on next to me and know that she was fine.
After 95 days in the hospital, Alyssa could finally go home.
And I'm just grateful that Children's Hospital, you know, is here in El Paso, UMC, together, you know, so that I could enjoy my miracle baby, Alyssa.
Children's Miracle Network has purchased important life-saving equipment for NICU babies. In most cases, the money raised to purchase these devices was raised $1 at a time.
I didn't realize that all those were donated, and I am very thankful that they were.
I think that this hospital belongs to the community, and we are here to take care of the community, and I think we provide an excellent service. I don't think that any of the other hospitals have the depth of the consultants that we have here when you combine UMC, Texas Tech, and Children's Hospital.
In order to do what we can do, we are reliant on the generosity of the community.
Yeah.
They very much became our second family, and if it wasn't for them and all the wonderful things that they do, I'd hate to think where we would be. They have taken wonderful care of her and given us this gorgeous girl that we get to bring home.
Doctors and nurses could not provide the care these babies need without your generosity, without your support. So every time you ask, will you donate to Children's Miracle Network? Think of the many lives you play a part in saving with that simple question.